if you bend your knees and grab the sides of the sticky mat and push, grabbing the mat, push down towards the wall. Down means away from the head towards the wall. And feel the skin of the sacrum, the skin of the pelvis sliding towards the wall, towards your feet. And if you hold that grip, continuously slide towards your head, away from the feet, away from the wall, you'll continue to traction your lower back and get more and more length. Mm. And that relieves back strain. Mm-hmm. It's a little easier than the other one with the legs straight. You have to be more precise and careful, whereas here, you get the result easier. Yeah, it's more obvious how to do the pose. Because lying down and standing are different in terms of the lumbar lower back curve, spinal curve. We tend to hyperlordosis or hyper arch, and so the shortness comes in the back from standing and lying down, not sitting. Sitting we tend to convex or curve the back, not arch. So anyway, this lengthens out that shortness that happens from standing and lying down. The shortness comes in the back from standing and lying down, not sitting. Sitting we tend to convex or curve the back, not arch. So anyway, this lengthens out that shortness that happens from standing and lying down. So it neutralizes the pelvis and lengthens out these tight fibers. So that kind of back traction is a simple way of relieving strain in the lower back. Mm-hmm. So I'm giving you time to do it because it's so relieving.
Feels good. Yeah.
Yeah, something like this is so simple, and unless there's this time that you give yourself permission to take care, you wouldn't hold it as long.
Yeah.
So lengthen the back of your neck while you do that. You can reposition your hand every now and then if you've already slid. Bring your hand closer to your head and then grip and pull down.
Oh, yes.
Yeah. And then let your breath flow respond to that traction, lengthening in your lower back. Your breath will flow freely because it's a good action. The breath will flow freely when the action is good for you, when the alignment that's happening or the movement of the skin, muscle, and bone is healthy. The breath will flow freely. And if the action is not healthy, the breath will be cut off. It won't continue deepening. So taking 3 to 5 minutes or even longer, 10 minutes, just to traction your lower back can be a wonderful way to relieve strain in your back. And just that alone can be enough, but there are more things that we'll add. Poses that will relieve the low back, starting with the next pose. Oh, you wouldn't mind even continuing longer, right? Because it's so relieving.
Here forever.
Yeah, as long as the sacrum is continuing to drag down because you're gripping the mat and pulling it down, there's a continuous lengthening of the fibers. You can move your hands towards your head so that there's a continuous lengthening of fibers. And that's just can go on and on and on and lengthen, and the lengthening of the tissue goes deeper into the body, closer towards the center of the body, away from the skin. The periphery of the body is the skin. And so fiber by fiber, the tissues lengthen, stretch, open up. And that takes time. So having lengthened out your lower back like that with that traction pose, then let's utilize that length in the next pose, the one-legged stretch. Okay, so now keeping that in mind, have your feet at the wall with your knees bent, and then slowly with your feet more than hip width apart for pregnancy, push the heels very slowly, as if you're in slow motion. Straighten the legs so that you drag the buttock skin down from top buttock down to the bottom buttock. Watch your breath flowing freely.